Namaskar. Welcome to my channel Yoga The Journey Within. If you like my videos, please do subscribe, like, share, and don't forget to press the bell icon. Before going ahead with the breathing practices, I would first like to explain the physiology of breathing because you should know how it works. Diaphragm is the main muscle responsible for breathing or for respiration. So diaphragm is a dome-shaped muscle and which separates the thoracic region from the abdomen region. Lungs are placed over the diaphragm and lungs are surrounded by rib cage. Rib cage has got spaces which has got intercostal muscles in them. In front, ribs are attached to the to sternum, that is the breastbone, and behind it is attached to vertebrae. So what happens when we inhale, our diaphragm contracts and it moves down to 2 centimeters down. It compresses the organs like stomach, gallbladder, liver, which in turn bulges out. And due to the intercostal muscles, the rib cage and the lungs expand. When it expands, that means volume increases and the pressure decreases. We know that volume is inversely proportional to pressure. So inside pressure is less and outside is more. Because of that, the air enters inside. This is how breathing works, and we are supposed to breathe and make use of the diaphragm while breathing. Let me explain the movement of the ribs. See, it is also called as bucket handle movement. Ribs are attached here in front to the sternum or the breastbone. Behind it is attached to the vertebrae. So during inhalation, the rib cage expands and moves like this. Okay, this is how it works. And along with that, the lungs also move and expand. And expiration actually is passive. We don't have to take any effort for exhalation. So have you ever seen a newborn child sleeping? How rhythmically the abdomen goes up and down? This is how actually we are supposed to breathe, but we don't breathe it that way. Because of certain reasons like environmental conditions such as temperature, noise, pollution, anxiety, stress in our day-to-day life have really altered our breathing patterns. So what happens when we inhale, take a long inhalation and a long exhalation, it triggers our PNS system. And what is that? It is parasympathetic nervous system. Autonomic nervous system has got two wings. One is parasympathetic nervous system, second is sympathetic nervous system. Sympathetic nervous system is responsible for our fight and flight response. What does that mean? Suppose a fire broke out at our place or a dog is chasing you. What will happen? Your BP will go up and down. You will become nervous and you will have palpitations. Cortisol level or the stress hormones will shoot up, right? So this is called as fight or flight response. But PNS, it works just to calm down the system. It is just the rest and relax, we call it. It relaxes your nervous system. It calms down and lowers your blood pressure. I mean, it will become normal. And this is how it works actually. But we, in our day-to-day life stress, we don't allow our PNS system to work because we breathe, our breathing is shallow. So the length is not enough. I mean, the exhalation is not long to activate that PNS system of ours. So our main aim is we should harmonize both. Deep inhalation and deep exhalation allows us that the PNS and SNS system, they both work in harmony with one another. So it is said that day-to-day stress, what it triggers our cortisol level. Like if you're running late and you have to reach airport, your BP will go up and down. If stock market is going up and down, your BP also goes up and down. Your cortisol level or the stress level will rise. So at little small things in our day-to-day life, our cortisol levels keep rising. And we don't get a chance for give a chance to PNS system to work. And what will happen? If every time the cortisol levels keep rising, it will eventually manifest into diseases. Correct? This is why most of the diseases are psychosomatic, because it is related to stress and we need to calm it down through breathing. This is the reason when we have panic attacks or we are under stress, we are asked to take a long deep inhalation because it relaxes our nervous system. Most of us do shallow breathing. females, they do thoraco-abdominal breathing. That means they make use more of the thorax region than the abdomen. Whereas men, they do abdominothoracic breathing. That means they use more of their abdomen than the thorax region. There are various reasons for that. I'm not going to go into details for that. But how will you make out your breathing is shallow? Place your left hand on your chest and the right hand on your abdomen, and then take a deep inhalation and see, observe what your if your chest rises first and it rises more than your abdomen, that means your breathing is shallow. Whereas if your abdomen rises first and it is more than your chest, that means your breathing is abdominal breathing. So we humans actually breathe 15 to take 15 to 20 breaths in a minute on an average, whereas dogs take 30 to 40 breaths in a minute and they live for 14 to 15 years. And whereas tortoise, they take 3 to 4 breaths in a minute and they live for 150 to 200 years. That means if we do deep breathing on regular basis, it will not only enhance your lung capacity and improve or increase your oxygen level in your blood, but it will also increase your lifespan. So daily 10 minutes of practice of these deep breathing exercise can do wonders actually. If you don't have 10 minutes, doesn't matter. Whatever activity you are involved in, just take a pause and keep inhaling and exhaling. Long deep inhalation and exhalation. This will also make really a vast difference. It will be a subtle effect you won't even come to know, but doing it regularly and practicing regularly, you see the difference and feel the difference, I would say. So pranayama is a journey towards health. Let us walk together. In my next clip, I'm going to talk about deep breathing exercises. Until then, keep smiling, stay healthy, stay fit. Namaskar.